Hey there, this is Dr. Renee Watts, and today we're going to talk toothbrushes. Some of the most common questions that we get are what type of toothbrush should I be using? So I thought we would just talk about some guidelines today, since when you're at the store trying to choose one, it can be a little overwhelming. There are a lot of great options. So the first thing that's going to be a pretty near universal recommendation by all dental professionals is to use something with some soft bristles. It's been shown that when people use medium or firm bristles over long periods of time, that those can actually damage and wear your tooth enamel and your gums. So something with some soft bristles. You also want to choose a head size that's going to be small enough to where you can maneuver it around to all the surfaces of your teeth and the different areas of your mouth. So if you're an adult with a small mouth, even sometimes a child's brush can even get to some of those spots a little bit better. You want to choose a handle that's going to be comfortable for you. This brush I like a lot. It's got a little fatter, more cushiony handle, and so especially if someone has arthritis or other dexterity issues holding onto a brush, that can be a little more comfortable. Or you can ask your dental hygienist for some tips as well on how to maybe modify a brush if you like the head otherwise. So in terms of a power brush versus a manual brush, and what to choose. Some of that, again, is going to be your personal preference. Sometimes we'll recommend power brushes for people who do have dexterity issues, but both of these can do an adequate job getting the plaque off of your teeth. So the more important thing is just going to be the time that you spend and the technique that you use in using whichever brush that you choose. So with the manual brush, you want to just take the bristles and angle them at about 45 degrees towards your gum line, do small circles all the way around. With the power brush, you're going to use it a little bit differently. Because the bristles of the brush here move themselves, you don't need to do as many small circles. You're just going to hold it, again, at about a 45-degree angle along the gum line and move it a little bit more slowly because the bristles are going to be doing most of the work. Now, this power brush has a couple extra features on it that are sort of nice. It has a 2-minute timer, which is about how long people really should be spending to get all the surfaces of their teeth clean. So it'll beep every 30 seconds to move you on to the next quarter of your mouth. But if you're using a manual brush, you can use the 2 or 3 minute guideline as well. If you have music on, about 3 minutes is going to be the average song that you'll hear on the radio, or if you have the TV on, a couple of TV commercials will usually take about 2 minutes as well. In terms of when to replace your brush, of course, we recommend replacing it about every 3 months or when the bristles start to get splayed or so. So you can put that on your calendar, in your phone, take a Sharpie and write it on your toothbrush. A couple other things to think about. This toothbrush holder has a sterilizer in it. It's got a UV sterilizer, which is kind of nice. You take the head off and put it in there. And it just helps keep things a little bit more hygienic. If you get sick, if you get a cold or strep throat, then it's also, again, recommended to replace your brush because that can harbor bacteria and viruses. But if your brush is still in pretty good shape, you can put it in your dishwasher and that will sterilize it as well. So last thing, of course, even the best brushes are only going to get 3 sides of your teeth clean, the biting side, the cheek side, and the tongue side. So you also just want to make sure that you're also using some type of thing to clean in between your teeth, some floss, toothpicks, interdental cleaners. So I hope these tips have been helpful for you today. Thanks for watching and happy brushing.